Discover how medical students practice procedures without patients. In this shocking episode of James Gill's podcast, the controversial way future doctors hone their clinical skills using advanced anatomical models.
Hello, my name's James Gill.
But also raises questions about the ethics and necessity of such methods in clinical education. Do not miss it. Full podcast in video description.
Thank you for joining me here on this next clinical skills video. And I'm actually in one of the practices where I locum at the moment, hence the...
Manufactured by the company Limbs and Things is revealed. These models, designed to avoid repetitive practice on real patients, allow students to perform delicate and complicated requests without causing discomfort to living people. Full podcast in video description.
Current get-up, and we've been visited by Limbs and Things here today. Basically, the last word in anatomical models.
James Gill, from his office, presents us with the fascinating world of these models, which include replicas of breasts with various pathologies and testicles with tumours and other conditions. These devices provide an unprecedented learning experience.
Models for practicing clinical skills. Now, what I mean by that is that they produce a huge number of models,
increasing students' confidence and competence in procedures that might otherwise be extremely uncomfortable or painful for patients. The podcast highlights how, in the educational environment, conditions such as testicular tumours, epididymitis, and hydrocele can be recreated.
That we can use in order to allow students to improve their knowledge of clinical procedures without having to learn.
These models not only allow the practice of intimate examinations, but also facilitate the placement of different pathologies within the models, providing a realistic and varied simulation for students. Furthermore,
on a patient. So these tend to be procedures that you wouldn't want to perform repeatedly on a patient. So a good example there being...
Gill highlights the importance of these models in teaching rectal and genital examinations, procedures that are often avoided in real clinical practice due to the discomfort of both patients and clinicians themselves.
Breast examinations. These guys have a wonderful collection of different breast models, which for myself as an educator...
Lack of experience with these tests can lead to late diagnoses and missed opportunities for early treatment of serious illnesses. To mitigate this problem, Gill explains the use of prostate models with various pathological conditions. Students can practice rectal examinations.
And as a clinician, we can actually choose the pathology that we want, place it in different locations within the silicone breasts, and
learn to identify various abnormalities, such as prostate carcinomas and benign enlargements, without the stress of performing these procedures on living patients. The comments section of this video is carefully moderated due to the sensitive nature of the content.
Have a student model them, allowing for the appropriate examinations to be performed in a non-clinical or an educational setting.
Ensuring only constructive and relevant comments are posted. This episode not only illuminates the innovative approach in medical training,